Monitoring blood pressure regularly can provide valuable information about an individual's risk for heart disease, stroke, and other cardiovascular issues. Knowing these risks helps guide preventive measures in preventing serious medical conditions. Understanding blood pressure readings is crucial for monitoring heart health. Blood pressure is typically recorded as two numbers, representing systolic and diastolic pressures. Systolic blood pressure measures the pressure in your arteries, the blood vessels that takes oxygenated blood away from the heart when your heart beats. A normal systolic pressure is considered less than 120 mercury millimeters. Diastolic blood pressure measures the pressure in your arteries when your heart is resting between beats. A normal diastolic pressure is less than 80 mercury millimeters. This resting interval between heartbeats varies based on a person's heart rate. For a person with a heart rate of 60 beats per minute would have an average resting interval of 1 second. And a normal resting heart rate for adults ranges from 60 to 100 beats per minute. Generally, a lower heart rate at rest implies more efficient heart function. There are several key steps to follow to record the blood pressure accurately. Before measuring the blood pressure, do not eat or drink for 30 minutes and empty your bladder. During the measurement, do not talk, rest your back, and keep your feet flat on the floor. And your hand should rest at chest height. The reading you get from an accurate measurement can indicate whether you are at risk of hypertension. Before moving forward, please take a minute to subscribe to my channel. Thank you. Let's continue. High blood pressure, also known as hypertension, can be caused by a variety of factors. Let's look at some of those factors. Genetics or the family history plays a significant role. If your parents or close relatives have high blood pressure, you may be at a higher risk. Unhealthy lifestyle like poor diet, lack of physical activity, excessive alcohol consumption, and smoking can contribute to hypertension. Being overweight or obese also can increase the risk of high blood pressure. Chronic stress can lead to high blood pressure over time. Blood pressure tends to increase with age due to stiffening of arteries and other physiological changes. Certain medical conditions such as kidney disease, diabetes, thyroid disorders, and sleep apnea can contribute to high blood pressure as well. Some medications, such as birth control pills, cold remedies, decongestants, and over-the-counter pain relievers, can raise blood pressure. Consuming too much sodium and too little potassium in your diet also can increase blood pressure. You can take several steps to improve your lifestyle to control the high blood pressure. Focus on a diet rich in fruits, vegetables, whole grains, and lean proteins. Reduce sodium intake, limit processed foods, and avoid foods high in saturated and trans fats. Engage in regular physical activity, aiming for at least 150 minutes of moderate intensity exercise per week, or as advised by your healthcare provider. Activities such as brisk walking, swimming, cycling, or jogging can help lower blood pressure. Losing excess weight and maintaining a healthy weight can significantly lower blood pressure. Aim for a body mass index within the healthy range. Quit smoking. Smoking can raise blood pressure and damage blood vessels. Quitting smoking is one of the most important steps you can take to improve your overall health and lower blood pressure. Practice stress reduction techniques such as deep breathing, meditation, yoga, or mindfulness to help lower stress levels and manage blood pressure. If lifestyle changes alone are not sufficient to control your blood pressure, your healthcare provider may prescribe medications. Regularly monitor your blood pressure at home using a home blood pressure monitor. Keep track of your readings and share them with your healthcare provider. Follow your healthcare provider's recommendations regarding medication, lifestyle changes, and follow-up appointments. Be proactive in managing your blood pressure and communicate any concerns or changes in your health to your healthcare team. By adopting these lifestyle changes and following medical advice, you can effectively control high blood pressure and reduce the risk of complications associated with hypertension. I hope you enjoyed this video. Thank you for watching. Don't forget to subscribe.